For joining us for today's webinar about the status of child health in Texas. My name is Joel Romo, and I'm president and founder of Texana Public Affairs and chair of the Legislative Committee for the Partnership for Healthy Texas. Today's webinar is hosted by the Michael and Susan Dell Center for Healthy Living at UT Health Houston School of Public Health. The center's vision is healthy children in a healthy world, with a mission to advance health and healthy living for children and families through early and impactful interventions. Thank you to the Michael and Susan Dell Foundation for providing funds to the center to host today's webinar. Additionally, information about the center's work and resources can be found online. Please scan the QR code on your screen to access our health resources. The slides and a recording of today's webinar will be archived on our website, msdcenter.org. If you have any questions during the presentation, please enter them into the questions chat box for the Q&A session at the end of the presentation. With that, I'm excited to introduce our speaker, Dr. Deanna Hosier. Dr. Hosier research interests include teaching children and their families to engage in healthier dietary and physical activity behaviors to avoid chronic diseases, with an emphasis on addressing health disparities. Her recent work has focused on implementing interventions and evaluations on policy, systems, and environmental changes, especially focused on maternal and child health. She is a director of the Michael and Susan Dell Center for Healthy Living and dean of UT Health Houston School of Public Health in Austin. Additionally, Dr. Hosier is the principal investigator of the Texas School Physical Activity and Nutrition Study, or Texas SPAN. I'll now hand it over to Dr. Hosier with her presentation on the status of child health in Texas, results from the Texas SPAN 2021-2023 survey.
Great. Thank you, Joel, and glad to see everyone here this afternoon. I'm very excited to present our results from Texas SPAN for the years 2021 through 2023. These are the first data on child obesity, nutrition, and physical activity are among the first data after the COVID-19 pandemic. So we were really interested in seeing how children fared during that time period. So before I start, I'd like to acknowledge our funding for the next slide, please. So our funding for the project, which is from Texas Department of State Health Services. And then I'd also like to acknowledge all the groups who helped us with this survey, as well as the school districts, children, schools, and parents that participated. We couldn't do it without every one of you, and so we are deeply appreciative of your efforts. The next slide, another group we couldn't do without is the Texas SPAN research team, and some of you I know are on the webinar today. So again, thank you for all your hard work on SPAN. Texas is a big state, and recruiting students to participate in the study is a big job. So what is Texas SPAN? So the goal of Texas SPAN is to monitor the prevalence and secular child health trends in Texas school children. So it's statewide in Texas. We also look at different regions, and particularly the border, non-border regions. So that's one of the unique features of Texas SPAN. We also look at student behaviors associated with obesity. And SPAN information has been important to help with program development and policies for healthy weight and chronic disease among Texas youth. So SPAN 2021-23 is the 6th time that we've conducted this project. So we began in 2000 and 2002. We've also collected in 2004, 2005, 2009, 2011, 2015, 2016, 2019, 2020, and then 2021, 2023. So we've really got some nice trend data now. Next slide. So during SPAN, we collect children's height and weight from second, fourth, eighth, and 11th grade. So we try and capture early elementary, late elementary, middle school, and high school. We also consider this pre-puberty, puberty around eighth grade, and then post-puberty. So different developmental levels of children, as well as elementary, middle, and high school. So we collect self-reported paper or online validated questionnaires to students of fourth, eighth, and 11th grades. And so these contain demographic information, so some information about the kids, diet, physical activity practices, knowledge, and then some constructs such as oral health. For second grade students, we have a take-home or online survey for their parents. And this also assesses the child's diet, activity, and oral health behaviors, as well as related constructs. But in that case, the parent completes it. I will tell you that for our surveys, that for the 8th and 11th grade, most of the surveys that were completed were online, whereas for 4th, they tended to be on the paper version. And then we also look at school policies and practices. So we have a school health policy questionnaire that we use where we ask about school policies related to around food and physical activity, recess. We also look at campus improvement plans, a vending machine inventory in the secondary schools, and then signage observations. Next slide. So this shows our statewide participation. So we had close to 11,000 children who participated in this study. We looked through all the public health regions in Texas. We assessed a total of 61 districts and 231 schools. So you can see the number of students participating. We had the highest participation in fourth grade and then the lowest participation in second grade. And if you look at that, these surveys represent the population. So these are weighted data. So the data that I'm presenting are representative of the state unless I indicate otherwise. So we're able to use weighted data similar to what Haynes uses to approximate data for the whole population. Next slide. So this is a quick peek at the demographics of our SPAN sample. So if you look at the gender distribution, it's approximately half boys or girls. If you look at the racial ethnic distribution, it tends to be majority Hispanic, which is similar to the enrollment in public schools in Texas. And then if you look at the average age, you can see it ranges from 7 to about 16, 17 in terms of which ages match with which grades. Next slide, please. So kind of to give you kind of a first peek at these data, these are the child obesity trends in Texas from 2000, 2002 to 2021, 23. So to follow this, the orange line, which goes across there, is in grade 4. The green line is grade 8. The blue line and time points are grade 11. And then the purple line and time points are grade 2. So the data for grade 2 weren't available before 2015, 2016. So that's a shorter line than what you'll see on the others. So if you look at these just on their own, you can see that grade 4 we had an obesity prevalence of close to 26% when we started in 2000. It dipped slightly for 2004, 2005, 2009, 2011, and then it went back up on the next 2 time points. But then this last time point, we actually saw a decrease in obesity among fourth graders. For second graders, we also saw, if you follow the purple line, we also saw a decrease in obesity. Now, we saw a different pattern with the 8th and 11th graders. So looking at the green line, if you follow that from 2000 to 2021-23, you'll see an increase in obesity over time. And then you also see an increase in the blue line for the 11th graders. Now, if you could click on the next. This is the Healthy People 2030 goal, which is the health goals of the nation. So it's 15.5%, and you can see that we're well above that at all grade levels, even in 2021-23. And then if you look at where we are in the United States, so the 15.5 is a goal, but if we could click again, the red line shows data from NHANES, so the nationally representative sample of 19.7%. So we're still above that, especially for the 4th through 11th graders. I will tell you that we don't have more recent data on a nationally representative sample yet, so that should be coming out fairly soon. Next slide. So the other thing we're worried about in Texas is the prevalence of children with severe obesity, because we've seen increases over the years. So here you can see, this is just for 2021 through 2023. And so if you look at 2nd, 4th, 8th, and 11th grades, you see that the prevalence of children with severe obesity increases with increasing grade level or age level. You can look at the red line there, and you can see from a nationally representative sample that it's 6.3%. So we exceed that in grades 4, 8, and 11, which really is an issue because we know that obesity tracks over time. And so children who have severe obesity at younger ages and into adolescence are likely to be adults who have obesity. So this is something that we are very concerned with. Next slide. So this shows the border county obesity prevalence by grade. So if you look at these data, the green bars indicate what the obesity prevalence is at the border counties. So that's the counties that border the Texas-Mexico border. And then the orange bar is for non-border counties. So when you look at this, among the younger kids, the 2nd and 4th graders, there are differences in obesity prevalence by grade. But then as you look at the 8th and the 11th grade, you do not see those differences. Keep in mind that overall the obesity prevalence did decrease overall for 2nd and 4th graders, but it increased in 8th and 11th graders. So it might be that those decreases were more on non-border areas than they were with border areas. Next slide. So the next set of slides I'm going to talk about dietary intake with kids. And so when we ask in SPAN, we ask about the previous day, and it was a school day. So keep in mind that these are school day data. So this one right here shows the number of time that fruit and vegetables were consumed per day by grade. And we did not include juice in these measures. So juice is we kind of like to look at it in a category by itself. So we have this divided. The green bars indicate 3 or more times per day, and that's recommended for fruits and vegetables. And actually, it should be higher than that. It should be closer to 5 to 7 to 9 servings a day, depending on how old the children are. So what you can see here is it's close to 50%. It dips a little bit in 11th grade. But if you look at the orange bars, those are children, the percent of kids who reported consuming no fruits or vegetables on the previous day. So when you look at that, that's especially concerning among 4th, 8th, and 11th grade kids. So it's approaching 20% in the 11th grade kids. And we know that school meals do provide fruits and vegetables. So the kids are not eating fruits and vegetables, or they're bringing meals from home that don't include fruits and vegetables, or they just don't like them and they're not eating them. So that's something that we need to pay attention to. Next slide. So this is the number of times that sugary beverages were consumed per day. So the orange bars are 3 or more times a day that they consume sugary beverages. And these include regular sodas, coffee or tea with sugar, fruit drinks, flavored milks, and energy drinks. And then the green bars are those children who reported consuming no sugary beverages per day. So as you can see here, especially when you look at the 4th, 8th, and 11th graders, that close to a third of these children consume sugary beverages 3 or more times a day. So this is really an issue because we know that consumption of sugary beverages is associated with child obesity. Next slide. So these show the number of times that milk was consumed per day by grade. So if you look at these, the first set is of plain milk. So this is kids that reported consuming just unflavored milk. And so the orange bar is none. The green bar is 2 or more times. So what you can see here is 2/3 of 11th graders do not consume any plain milk, or didn't on the previous day. And over 50% of 4th and 8th graders consume no plain milk on the previous day. However, when you add flavored milk, which is the second graph on this slide, you can see that it does make a big difference in the consumption of milk. So our issue with that is it also adds extra sugar and calories to kids' diets. But it was interesting to see the difference in milk intake when you added flavored milk to the equation. Next slide. So this shows the number of times sweet and savory snacks are consumed per day by grade. And so with these data, what's interesting about these is this was computed by what kids reported as candy, frozen desserts, cakes, French fries and chips, and snack bars. So all of these foods are considered ultra processed foods for the most part. And so as you see, there's a high consumption of these ultra processed foods by children across all grades. It's especially high among second graders. They tend to snack a little bit more. But as you can see, it's 40% or more of kids consume these foods 3 or more times a day. So that really is something that we need to look at. How can we make healthy snacks more available? Next slide. So this question asked about the number of time restaurant food was consumed per day by grade. So keep in mind that this is during the school week. And the orange part of the bar is kids who reported eating at a restaurant at least once. And the green bar is those that said that they didn't eat at a restaurant the previous day. The orange bar did not include like if they had eaten school lunch or breakfast. So they didn't include school meals. But what you can see is 40% or more of kids are eating in a restaurant every day. So it's really important that they have healthy choices at restaurants, especially if they're eating that much at restaurants. The other thing we can take away from this is we might need to do more parent education for them to prepare healthier meals at home that are quick and that they can prepare relatively easy. Having 4 kids myself, I know that it's often a struggle, or in the past, they're all grown now, but it was a struggle trying to get meals on at night. Next slide. So this slide shows the percent of kids who reported not eating breakfast on the previous day. So if you look at 8th and 11th grade, more than 40% of the kids reported not eating breakfast the previous day. This is an issue because the Dietary Guidelines Advisory Committee did a systematic review of breakfast consumption in kids, and they showed that kids who consumed breakfast had better growth, body composition, and decreased risk of obesity. So that's something to really encourage is children eating breakfast, especially the secondary school kids. So now we're going to switch to physical activity. So one of our questions was last week, how many days did you play outdoors for 30 minutes or more? We do have a paper that's published that shows that kids who played outdoors were more likely to meet physical activity guidelines. So if you look at this, the green bar shows those that played outdoors for 5 or more days, and the orange part of this is fewer than 5 days. So about half of kids play outdoors for 30 minutes or more at least 5 days a week. So ideally, we would like it to be greater than that. And this was just the elementary school kids in 2nd and 4th grade. Next slide. So these graphs show the percent of kids who reported how many days they were physically active for a total of at least 60 minutes per day. So the green part of the bar shows children who were active for 5 or more days. We called that meeting the physical activity guidelines. Technically, you should be physically active for 7 days of the week. So we did the majority of days. But as you can see, the greatest percentage of those that met the guidelines were in 2nd grade. And then it decreased in 4th grade and increased a little bit in 8th and 11th grade, but it's still not as high. We would like to see it closer to all of the kids rather than hovering around 50%. This slide asks if kids participated in any other organized physical activities or if they took lessons. So this is like swimming lessons or could be karate lessons or things like that. And what we find is that you have greater participation in those physical activities or lessons in the lower age groups, and it actually decreases as kids get older. What we find is there is a bimodal distribution of physical activity. So you generally have kids in high school who participate in a lot of physical activity, that they're in sports teams, club teams, and then you have those that participate in relatively little physical activity. So, following with physical activity, we also ask about sedentary activity. And so, one sedentary activity that kids engage in a lot is either being on their computer, their tablet, iPad, TV, or any other electronic device for anything except schoolwork. So, this is for leisure time uh, sedentary activity screen time. So it doesn't count if they were doing homework. So what we see is at 2nd grade, they aren't spending a lot of time, or they reported not spending a lot of time on these devices, but you can see it really jumps up in 4th grade. And then in 8th and 11th grade, the orange bars are 4 or more hours on that. So that's in addition to any time that they spend on devices for schoolwork or other types of assignments after school. So this slide looks at students who met the sleep recommendations. And to me, this is a very alarming statistic, because when we look at the green bar, it shows the percentage of kids who met the guidelines, and the orange bar is the percentage of kids who didn't meet the guidelines. So Second graders, the majority of kids met the guidelines for sleep. For beginning in fourth grade, the majority of kids did not meet the guidelines, and it's especially low in 11th grade, where only about a quarter of the kids met the guidelines for sleep. So, growing kids really need good sleep hygiene. A lot of this comes down to setting bedtime routines, taking devices out of the room. So this is something that really can be worked on. A lot of this involves parent programs and also can be done by education with school kids as well. Next slide. In the second grade kids, we did look at the prevalence of food insecurity among families. We only measured this in second grade children because this is a question you need to ask the parents. So kids cannot adequately answer these questions. And so if you look at this, the 2023 USDA estimate was 17.9% of families with children had food insecurity nationally. However, statewide, we have higher rates of that based on our SPAN data. In non-border counties, you can see that it's much lower than in border counties. So in border counties, the prevalence of food insecurity is over 35%. So the school meal programs can really help in this regard and food assistance programs. So one of the sets of questions that were really interesting were questions that asked the kids about compared to during COVID or the previous year, what are you doing now in terms of behaviors? So we're going to talk through a little bit of these. If you could go to the next slide, just to orient you to these slides. The green portion of the bars indicates that behavior improved. The blue is it stayed the same, and then the orange is that it got worse. And so the directionality of this kind of changes, but if you keep your eye on, let's say, the green bars, you can get a good idea of where we went. And so again, we asked the kids, this year when you're in school compared to during the pandemic, how much do you eat junk food? And what we found is over 40% of the fourth, eighth, and 11th grade, kind of approaching 50%, said less than last year. So that was nice to hear. The next slide talks about eating fruits and vegetables. And we saw a similar pattern that more of the kids reported eating more fruits and vegetables when they were in school than during the pandemic. As you can see, fewer reported consuming less than last year. The next slide talks about how much do you drink sodas. And again, the green is less than last year. So that's the behavior that is what the healthy behavior that we want to encourage. And what we found is that kids were drinking fewer sodas than during the pandemic. And then the next slide talks about physical activity. And here we saw an increase in physical activity, that kids reported that they were more physically active when they were in schools than the previous year, like during the COVID-19 pandemic. And then we also ask them about how much time do you spend with friends in person. So we know that spending time with friends in person is often connected with student mental health. So what we found, and you would expect this, is the kids were reporting that they spent more time with friends in person than after the pandemic compared to during the pandemic. So taken together, you can kind of see that, and I'll mention this in a little bit, that behaviors tended to improve after the pandemic. So, just some summary and implications. One is Texas children have high obesity rates, but the rates vary by grade. So, severe obesity is problematic, and especially among the secondary school kids. So, that's really what we need to look at. There is a need for obesity prevention efforts and really looking at secondary school kids. A lot of times, these efforts are focused on elementary school kids. We still need to continue those efforts, but we also need to make sure that we do these programs in secondary schools as well. We know that ultra processed food consumption is high among Texas school children, particularly sugary beverages and snack foods. So we see that here. Texas school children do not eat recommended fruits and vegetables amount. Texas has a very robust agricultural program. So really we have access to a lot of Texas grown fruits and vegetables. So that might be a place that we can partner. Um, Children, especially secondary school children, skip breakfast at high rates. So this is an opportunity to promote school lunches, but particularly school breakfast. We know that most students in grade 4, 8, and 11 do not meet sleep recommendations. So parent programs to encourage sleep hygiene should be implemented. So here, what we see is that parent outreach might be a good idea. Food insecurity rates are high, especially at the Texas-Mexico border. And school food programs and national food assistance programs can help in this regard. And then in general, students reported healthier behaviors after COVID-19. And this phenomenon, and during COVID-19, a lot of the schools were, students were at home, and for good reason. But this is consistent being in school with the structured day hypothesis. So, this hypothesis shows that a school daily routine that includes physical activity and school foods at certain times of the day can encourage healthier behaviors. We also know that school meals have tight dietary recommendations on them as well. So that tends to help kids have healthier weights. So, very interesting data about schools actually being healthy for kids to that they can encourage health behaviors. So, I'd like to thank you. This, as usual, I'd like to thank Texas Department of State Health Services for funding this work. And I'm ready for any questions.
Well, thank you, Dr. Hosier. We will now answer some questions from our audience um, that have been submitted during the presentation. Just as a reminder, please be sure to type your questions into the chat box. So while we wait for the questions to roll in, do you have anything else you'd like to touch on?
I'm trying to think what other results that we found. We've been looking a little bit about trends over time, and even though we show a high prevalence of consumption of sugary beverages, we do know that consumption of some of those have gone down over time. So that's something that's encouraging, but we still have work to do.
Well, we appreciate the research and all that you have put in your team. And again, if anybody would like to answer or ask any questions, just please type your questions into the chat box. And bear with me as we see if there's any questions. At the point, I don't see any, but let me make sure. Here we go. They're coming in now. First question is, how many school districts were included? Is SPAN data available by county or school district?
We surveyed 61 school districts. So we do give school districts their own data back, but we don't give that out because it's specific for their school district. We are working, we have a SPAN Data Explorer, and we're working to update it with the state level data. So we do have it by state level and then border, non-border.
Okay. Right. One other question. What is the SPAN definition for severe obesity?
So for the children, it's based on the growth charts. So it's a kind of an interesting definition. It's 120% of the 95th percentile. So the growth charts are based on percentiles. So as I mentioned, it's a very specific definition that's being used now. So they expanded the growth charts a few years back at CDC to assess severe obesity. So that's it tends to be related to or analogous to severe obesity in adults, which is approximately a BMI of 40.
Got it. Thank you. Another new question just came in. Were any of the children homeless in the study?
We did not specifically ask about that. We do look at school characteristics. So we look at percent economically disadvantaged for the school district. Um, it's kind of hard asking kids about uh, asking them about economic how the family income or things like that. So we tend not to collect those data and collect them at the school level using the Texas Education Agency data.
Got it. All right, folks, we wait for any other questions. Reminder, you can type your questions into the chat box. We'll have a few more minutes for some questions. I don't see anything new coming in. Anybody? Last chance. Going once, going twice. I'll wait a few seconds just to work with our technology here, but let's see here. Here we go. Does a chart showing consumption of 3+ fruits, vegetables include starchy vegetables, or is it just green, orange, and other vegetables for the vegetable portion of the fruit's vegetable number?
It does include starchy vegetables, but not French fries or chips. So prepared in a healthy way.
Got it. All right, one other question. We got a couple more questions here. How is this data shared and implemented in school districts? And when will more current data be available?
So a lot of school districts use these data to inform programs. They can, when we measure within a school district, we give the school district a PowerPoint similar to this, but with their own data. In the past, a lot of school districts, they use it at the shack level. They use it for local wellness policies, for their triennial assessment as a metric for that. They also use these data to apply for grants. So in the past, they've used them to apply for grants for physical activity equipment and similar grants.
Got you. Okay. Thank you. Another question, which family healthy weight programs do you recommend?
CDC has a list of family healthy weight programs that they recommend. It's on the CDC website. I don't have access to that right now, but we can put it in and we can put it in the notes and send it along to people. So those are family healthy weight programs that are evidence-based.
Okay. We have couple more questions. Are there any questions around family cooking, eating, for example, eating meals as a family, and food shopping behavior?
There are questions about eating. Yes, there's a lot of questions about eating. Sorry. Um, there are questions about food preparation. So, what we find is a lot of kids do do help prepare the food even a little bit. So, we do have information on that. We don't have information about eating dinner as a family, so we don't have that.
Got it. Thank you. Let's see. I think we have a couple more questions here. Sorry, making sure. What parent programming and education are you working on?
We do a lot of programming. We have done a lot. We developed the Catch program, and so we tend to work with that. There's several other programs that are approved by TEA for coordinated school health. As I said, Catch is the one I'm most familiar with. We've also worked with obesity programs that are more focused on children who already have overweight or obesity. So we did work with the MEND program. So we have done some work with that. So I think in general, and I know that we do, as I mentioned, that list of CDC approved programs is a good one if you're looking at children who have overweight or obesity.
Thank you. Um, Another question here. Why were grades 2, 4, 8, and 11 specifically surveyed?
So when we originally developed the survey in the 1998, 99, long time ago now. What we wanted to do was to focus on certain grades that represented different levels of child development and then that represented the different grade levels. So we know that if you go into elementary school, they have different policies than middle schools, than high schools do. And there's also a different food and physical activity environment there. So it's important to make sure that you cover each of those different levels of school. And then the other thing, we selected second, fourth, eighth, and 11th grade. With second and fourth, we wanted to have a lower elementary school child and then an upper elementary school child. So there's a big developmental change, as you know, through elementary school. Then eighth grade, we wanted to get peri-puberty. The second and fourth grades were pre-puberty, and then the 11th grade was post-puberty. So we wanted to kind of cover our bases in different ways. As you know, Texas is a very large state, and you saw how many kids that each grade level represents. So it's really impossible to do this kind of survey at all grade levels. So you have to make a decision. So that's how we chose those grades.
All right, thank you. Another question. Can you share some of the best ways to share the health education information with the children in relation to your study results?
I think the best way for health education is to find evidence-based programs and to work with shacks and kind of existing legislation for school coordinated health programs. It's difficult at the school level because there's a big focus on academics, and so it can be difficult to get health education lessons within the schools. But you can find good allies in terms of the district shack. And then also, usually there are teachers and parents that are very interested in this at the school level as well. You can also work with your PTA. So those are all good suggestions for moving this forward.
Great, thank you. Another question. What are the plans for connecting Texas lawmakers to this data?
We did a presentation at the state capitol last year. So it was, I can't remember, it might have been in August or September. So with a preview of these data. So they also will be available on our website, and this webinar will be archived too, so we can disseminate those out to anybody who's
And,
interested. Yeah.
and I'm going to do an editorial from the Partnership for Healthy Texas and Texas Public Health Coalitions. We can help get this data out to those legislative lawmakers, particularly right now while they're in the middle of session and working on a lot of these policies that impact school policy. Couple more questions. What state is closer to the goals of Healthy People 2030, and what would be the difference when compared with Texas?
Some of the states, I'm trying to think which states were closest. I know that I want to say Colorado and Massachusetts tend to be higher. I think I need to go back and look just to familiarize myself with that. I will tell you, in general, southern states tend to have worse data than the northern states, um, and then the northeastern states. So that is kind of a general trend. A lot of the comparisons between states, there's a national survey of child health that's done, and with that, they are they ask the parents about their height and weight, and they look at 10 through 7 ages 10 through 17. So when you look at that, it's not the same as when you have the objective measurements like we do, where we actually measure the kids for height and weight. So sometimes those data are a little bit difficult to get. YRBS does have data, but again, it's child reported data, and it's just for high school students. So Texas tends to rank toward the bottom. It actually has kind of come up from where it was. It used to be like high 40s, but now it's kind of moved up a little bit.
Got it. How does this data compare to other states?
Texas is really unique in having this type of objective data. I know Arkansas did have data for heights and weights, but as far as I know, I think that they've discontinued that, or they've really scaled back on that. And they don't have their quality control measures were not always as robust as what we've used. So it's kind of difficult to get data like this at the state level, especially if you're looking at elementary school kids, the second and the fourth grade kids that we have. So we're really fortunate that Texas is being proactive in this way.
That's great. Do you know the percentage of schools surveyed who were utilizing an evidence-based health program such as CATCH?
We actually have those data right now, but we have not analyzed it. But that's a good question. We can go ahead and look at that.
Okay. Um, so if there are any reminder, if you have a question, type your questions into the chat box. We are coming up on 12:48. I want to try to get any more questions in. Let me check the little magic box over here. Um, we have one. Was there something in this particular span data that really surprised you?
Well, the biggest surprise was a decrease in the obesity prevalence among second and fourth grade. So we've been trying to rack our brains as to what the cause was for that. Kind of what we're thinking about with the 8th and 11th grade, when school pivoted to virtual, a lot of 8th and 11th graders still had their classes, and they ended up sitting for most of the day, a lot of screen time. And then sports in some school district, in most school districts were not held. So we think with the older kids that might have made a difference in the increase in obesity. With the younger kids, the second and fourth grade kids, at the time we asked the survey, they for the second grade, they would have been in kindergarten or first grade. For the fourth graders, they would have been in third grade or second grade during the pandemic, that period we had asked about. And so what we're thinking is they did not have as much screen time. Even if they were on screens, they weren't. So they had more time to kind of move around. Kids tend to be very active, and a lot of times when they go into elementary school, I know we've talked about recess, you know, kids need to get out there and kind of get the wiggles out. And so we're thinking that that might have contributed to that. The other thing is we know that there were a lot of food assistance that happened in terms of the cafeterias getting out pandemic EBT and preparing foods. And so that might have been a contribution as well. So that was really the thing that has surprised us. And we haven't seen any other national data yet that shows something similar.
Great. Thank you. Dr. Hosier, thanks again for a wonderful presentation and great data. We'll encourage everybody to get it out to their respective parties and organizations. It looks like we've covered all of our questions. With that, we want to thank everyone for attending today's webinar. The recording, slides, and resources mentioned will be posted on msdcenter.org. Please scan the QR codes to register for our upcoming webinars, such as a Food First Approach to Cardiometabolic Health webinar series, sponsored by Avocados, Love One Today, parts 2 and 3. And with that, we want to thank everybody for joining us today, and we'll see you next time.